Hi, welcome to the Recovery Roundup, our monthly exploration of sobriety, community, and well-being. My name is Carrie Dury. I'm the Director of Business Development here at Calvary Healing Center. And welcome to our very first episode of 2021. I think we all can rejoice that we've made it this far. Today I am joined by our Chief Executive Officer, Ramsen, Kasha. Thanks for joining, Ramsen.
Thanks for having me, Carrie.
I was hoping to really pick your brain on a couple of things today, specifically around the topic of goals and goal setting and what we're looking to do at Calvary here in the next year. So much of what we've done in 2020 was new, and we had to think outside the box and get creative on some things. And I'm imagining some of that's going to continue into this year. So first question, I'm curious to get your feedback and a little bit of insight. The importance of goals and setting goals. As a clinician, someone who's worked in this industry for a really long time, can you speak to a little bit about the importance of doing that, especially within our community? Again, your experience working with that a little bit.
Sure. You know, I just keep thinking, and 2020 really hammered this saying home for me, that old saying of "we make plans and God laughs" kind of thing. And it's like, well, that's really what last year was. As a clinician, one of the big things that we always want from our patients is to create a treatment plan. What is it that you're going to be working on while you're in programming, and then what is it that you're going to work on as an aftercare, continuing care plan? And we'll create those knowing that, as we call them, they're documents, because you have these wonderful plans, and then life decides to get involved, and you have to change your plans. That was 2020, I think, for everybody, not just in the industry, but in the world. We had these incredible plans of how Calvary was going to solidify some of the stuff we were doing and expand in other things. And really, come March 2020, all those plans shifted into how do we stay open with this virus that's kind of raging everywhere? What do we do with our outpatient groups? How do we keep our patients safe? We really had to shift very drastically to adjust to it. And of course, what we experienced was, it seemed like every other month, or every month sometimes, what the information we were working off of got completely upended, and now there are new best practices and new warning signs, and we had to keep adjusting. So it's crucial to kind of step back from that and say, yeah, we changed the calendar flip to 2021, and we're all excited about that. And I don't want to be the wet blanket. I kind of feel like I'm going to come off that way here, but it's the pandemic still here, although we're seeing some positive signs now. But we still have to deal with it, and it's not going to go away anytime soon. Even once the vaccine starts taking effect, it's still going to take time for a rollout and such. But 2020 was very much about the action. And so now here we are with 2021 with an ability to step back and say, okay, now we know more about this virus. We know more about what's going on. It's time to get back to planning and acting and less on reacting.
Right, exactly. With that being said, and knowing that to use the kind of that statement, moving the goalpost, things change. Your goals one day can look totally different than the next. We experienced that all firsthand in 2020. I would love for you to share a little bit of your thoughts on maybe what we can do or looking at here at Calvary in 2021. Knowing though, with that asterisk, that this is subject to change, given the state of affairs, whether it's in our state or nationally or even locally, just in our county. What are some things that we have on the horizon here this year at Calvary?
Well, one of the big focus items we had in 2019 going into 2020 was looking at our outpatient programming. Calvary's been around it's closing up on 60 years now. But our outpatient programming is a little bit newer, especially the fact that we have, satellites in both the East and West Valley. This is new, and we want to make sure that we're not just doing a good job of creating programming for our patients who are stepping down, But the reality is there are a lot of people who may not need residential, but still need the support, the clinical care that outpatient can provide. And so, we're looking at 2021 as a time to reinvest in our outpatient programming. We were so excited in early 2020 that we had this new building that we were going to use for our East Valley programming. And as things were starting to, finalize and get ready for a launch and an open house and all those wonderful things you do, we were forced to go virtual. So it's delayed, but it's like a new toy. We still have this new building, wonderful facility that we can do both programming for various times and groups, but we can also do some more professional education seminars and such. So hopefully we get a chance to really use that new East Valley location to its fullest extent this year. Luckily, also towards the end of last year and beginning of this year, we've been working on our West Valley location. So I should go back to the new East Valley location being in Tempe. The West Valley location, what we're doing is we're looking to get closer to where our patients have been, where the need is. And so we're moving it a little bit further towards Glendale in the Arrowhead area. And we're about a month away from having it and finalizing it and being able to open that. And the thing about our outpatient is, although a lot of our programs one thing that we've done is we have started to go back into doing some live and smaller groups, where we've shrunk the capacity down to meet the standards for keeping patients safe. But we have gone back to some live outpatient programming, and we really want to start having that be a common theme for all of our sites, to do both virtual and live. What we're hoping also to do, and this is, there are a couple of things that came out of this pandemic which force us to look at things differently, and in some cases move quicker. Virtual IOP is one of those things. There are a lot of concerns. I know as a clinician, there's always been this concern about, do you get as much impact out of virtual as you do with in person? I think we're in a different place now than we were 10 years ago. 10 years ago, I would have said, no, it's not a good idea. You don't get as much. But really, look at what we're doing right now with how we're recording this. And, the reality is with FaceTime and all sorts of other things, our culture here has gotten so much more comfortable with virtual communication. And so that opens up a door that if for some of our patients who aren't able to attend our outpatient programming but need that support, or maybe they live in areas where there isn't any outpatient programming, our virtual programming is an answer for them. And so we will continue our virtual IOP even after we get on the other end of this pandemic. And so that becomes a new target for us that we didn't have at the beginning of last year, but we've developed since then.
Yep. With that and the virtual platform, I know our family support and education group has moved to a virtual status indefinitely as well. I know there's some talk about trying to bring that back in person, but time will tell. I don't think we're going to be rushing that one either. But I know we've had to convert kind of that for a lot of our patients, their families, in order to communicate and for them to get some of the support that they need. We've been Zooming in and working with our counselor that way too. So I'm imagining that's probably going to stay the same for a while too.
Certainly, we understand that the family component of this disease is so. I've said it a number of times, and a lot of people said it. This disease is one of separation, of isolation, and so part of the response to this disease has to be reconnection, and the family is such an important part of that. And when I say family, I'm including loved ones of a variety of different titles and connections. We're definitely going to keep doing our virtual programming for sure. We keep the patients engaged. We keep the family engaged, whether it's through that virtual programming or with virtual individual family sessions that are done with the patient and the therapist. So that's stuff that we've continued to do. I would love to give a date to get back to in person, but I would say the family program is probably one of the hardest things to put back in a way that will, we can be assured of safety for the patient. Because first of all, if we're doing groups of let's say 6 instead of 12, just to maintain that space, now all of a sudden it's 6 plus family, and that grows the group out. Secondly, it's a lot more people that we really don't have day-to-day contact with to make sure that they're keeping themselves as safe as possible. So yeah, I don't really have a time frame for that, but we're definitely looking at how we're engaging our family and how we're going to do it more.
Yeah, great. I guess I'll switch over. Maybe I know we've hit on some of the outpatient programming and some of our goals there. I know we have unique challenges on our inpatient side just due to the nature of how our program is set up. You know, a residential setting that we are, there are extra precautions that we're going to be taking every day to ensure the safety of our patients and our staff. So will those remain in place? And you can touch on that if you'd like to, about what we're doing to really, again, promote the health, wellness, safety of everybody in our facility, what that's looking like, but you know, how maybe we kind of start moving out of this space on an inpatient level, hopefully soon. You know, it's hard to predict, but I know, you know, our group sizes, for example, and patients wearing their masks and awaiting negative COVID results, you know, those are some of the defining things of our milieu. And you know, important and needed, but there obviously is going to be a time where we're going to have to probably transition back and out of this. So any comments or thoughts on that?
Certainly, we've already put a lot of things in place that will allow for that transition. I'm really very proud of how seriously our team has taken this. We're working closely with Maricopa County to really identify what is our best practice that we can employ here. So, you know, we've moved to a situation where we're testing everybody, and we're testing everybody weekly at this point. There might come a time when we can pull back a little bit on the weekly portion of that testing, but definitely one of the things that we've liked that we started doing is we've shifted. And initially there was more of a quarantining practice, but now I would say it's more cohorting. And I think that's kind of that answer, that middle ground. What we've done is we've added more programming, both clinical and just some more leisure activities on the detox side of what we do here. So as patients are, you know, getting through the physical component of their withdrawal, they can still participate in active treatment while they're in smaller groups. So, you know, as opposed to going into the residential side where the group size may be 7, 8 or something like that, it's groups of 4 early on until at least we can get the results back. So that way we can really have people distanced significantly in a room while we're awaiting their results. So that's something that we're going to continue to work on. But it's allowing us to create more individualized programming, which again, I hate to look at it as positives of the pandemic, but this is another one that, you know, even after all of this ends and we go back to business as usual, the fact is people withdraw differently. And we might have people who are not ready to step down to our residential program, but they're not also wanting to sit in their room and sleep all day and the such because they're feeling better. So now we've got more programming on top of the trauma response activities and the individualized care that we were already providing. Now we have groups and actual, you know, clinical tracking that we can employ on the detox side of our programming.
Right. I know we've spoken about this in previous episodes of Recovery Roundup, but you know, we had our director of nursing who came on and really explained what our COVID screening testing process is like. If anything, since then, it may have even ramped up even more since I think that was in November. So, you know, to just reiterate the frequent nature of us doing that with our staff and our patients, it's really become routine. It's part of who we are now. Hopefully it doesn't have to stay that way forever, but I do agree. I find that staff and patients really embrace it. It provides not a false sense of security at all, because we are, you know, delivering results not necessarily in real time, but very quickly. In any gap that we need to fill, we have a process in place, and we're going to continue to do that. I mentioned yesterday, it can seem redundant probably to keep doing the same thing over and over again, but it's all in the name of keeping everyone safe. So I do agree. Our, you know, nurses and our behavioral health technicians and you know, everybody, our therapists, everybody working with these patients have all really stepped up and done their part to make this as a smooth of a process as we possibly can make it. So I'm really proud of the team too, and I give a lot of kudos to my colleagues in that regard, because it shows. And I've heard many comments from patients who said, they really feel comfortable coming here. It's a big step to come into treatment to begin with. And then you throw in this other layer of COVID-19, and then things, it's a 50-50 shot. I don't know, maybe they'll be able to commit, maybe not. But I think we're trying to remove every possible barrier, despite the fact that we've been through a pandemic this last year. So, I know, go ahead.
Deciding to discontinue, using substances, it's clearly, from the outside looking in, it's like, well, yeah, that's definitely a great idea. It's something you should do. But the reality is that substance has served a purpose in an unhealthy way, maybe, but it has served a purpose for that individual for a long time. And here we are, where people are developing the courage to say, okay, I need to discontinue this. I need to stop this. If not for myself, then for my family, for my job, for whatever, but I need to stop it. It's harder, now, because there's other things I have to take into account. To stop it, I have to go into a group facility, and we know that here's this virus that just, is so super contagious and everything. So it's really it's our responsibility to do everything we can to take those barriers out of the way for them, because they're already doing incredibly hard work. And for us to be able to say, look, we're going to do everything we can to remove this huge barrier so that you can do that hard work in as safe a place as possible. It's not just good care, it's a responsibility.
Yeah, I love that. You're right. It is. That is our responsibility. And like you've said, we will continue to show up and be there and provide that support. That is our commitment and our pledge. Since the beginning for us, tracing our roots back, that is what Calvary has always been about. So I like where we're heading. I know we've had a very challenging, but maybe character building type of year. It's really brought out, different skill sets and opportunities to grow. We have turned some things into a positive, and I think that's going to be the trend this year too. By no means are we out of this yet, obviously, but hopefully soon. Hopefully that day is coming closer, because I know we're all ready for it, whether it's a vaccine or whatever the answer is for folks. I think we're all in agreement. So we'll be here doing our part, and to the community and to those who are watching, please let us know if we can help. We are always here, available to chat. We most certainly have a skilled team who is willing and able to do whatever they can to help get things back on track for you or your loved one. So with that, I guess we can wrap it up for today. Thank you so much, Ramsen. I really appreciate you taking a few minutes out of your busy day. And thanks everyone for joining this episode of the Recovery Roundup. We'll see you next time. Thanks, Ramsen.